Hi everyone, welcome to our YouTube channel. Today we are going to see the arthroscopic surgery in a 43-year-old female, wherein you can see some cartilage fraying and fissuring of the knee joint and the medial compartment. Here the MRI report said root tear of the medial meniscus with ACL injury. First, we'll be addressing the medial meniscus root tear, wherein the mark is being made. You can see there with the radiofrequency ablator, and then a curette is made to make a raw surface, and then the root is freshened, shaved. This is a curette. Now we will be taking a bite using first pass, which is also called a scorpion in conventional terms. This is a cinching bite which is taken on the medialmost aspect of the tone root. The second bite is also being taken for good strength of the fixation. This method is called pull-through technique of medial meniscus root repair, wherein the bites which were taken, the wires will be pulled to the tibial tunnel and a suture disc is placed. Now we are going to prepare the bed of femoral footprint tunnel for ACL reconstruction. This is the awl we call, and this is the bead pin. A good entry point is required for adequate ACL reconstruction, successful ACL reconstruction. After the suitable sized drill bit and drilling, after knowing the size of the ACL graft which is harvested from the patient's hamstring tendons, we will be deciding the size of the drill bit. You can see all the marrow particles. See, this is a beautiful femoral tunnel which is being done. Beautiful. There is adequate posterior bridge. Now we are coming for preparation of the tibial tunnel for the meniscal root repair. Once it's done, the wires which were taken, bites were taken, are pulled through the tibial tunnel to secure it. Yes, see, that is the root attachment of the meniscus posteriorly. This is very delicate and sensitive area. Should be very careful. Now we are pulling the threads, wires. Now we are pulling the threads through the drilled tibial tunnel. You can see with the help of suture puller. Yes, done. You can see the normal excursion at the attachment site of the posterior root. That is how we fix it. Now we are coming to the tibial footprint, wherein it is a stump preserving ACL reconstruction. After the bead pin drilling, now we'll drill with a suitable sized drill bit for the tibial tunnel. Yes, the drill is beautifully done, and you could see the preservation of the stump surrounding, and we'll be clearing the unwanted tissues at the tunnel site, but preserving the stump all around. That is the PCL which is behind that bead pin. You could see that shiny thing which is there. Yes, it's done now. Yeah, see, this is a tibial tunnel which is seen from the outside. Beautiful. No correlation of the meniscal root tunnel with the ACL tunnel in the tibia. That is more important in this scenario. Now we are passing the graft from the tibial tunnel to the femoral tunnel. This is the cinching threads which is going through the femoral tunnel from the tibial tunnel. Now we can appreciate a good ACL graft coming into the joint. While pulling, we'll have to witness the flipping of this endo button, which is more important. Yes, see, it has to go through the tunnel in this fashion and then flip outside the lateral aspect of the femur. Yes, it is flipped now. This is confirmed by pulling both the threads at the femoral end. Yeah, now we can see the entry of the graft nicely into the joint. Yes, yes. There will be a marking up till where the this blue color thread which you are saying is a mark up till which only we can pull the graft at the femoral tunnel.